Olympus 4K video tower. It's going to be shared between ortho, gynae, and general surgery. The nice thing is you have 4 camera heads, autoclavable. You no longer have to drape. You have 4 of these available. So they're going to be coming in sterile trays, okay? The camera head itself, anything gold here shows autoclavable. The buttons 1, 2, and 3, it will be lamp on, white balance, and take pictures.
Number 3, take pictures.
Yeah.
Okay.
Gray button here is continuous autofocus, and then the gray buttons here are manual focus.
Okay.
So if you're using laparoscopes, any scopes 5 millimeter and larger to 10 millimeter, continuous autofocus is great. But for 4 millimeter and smaller telescopes, for example, an ENT or ortho, these will be good to do the manual focus. Okay? This moves to the side to attach to your telescope, just a standard. And then we have our Olympus light cords. So you want to make sure you request those. 2 new we have some new sets. This is an Ultra HD laparoscope with infrared capabilities. So you have to make sure for the large bowel cases in which you're going to do the ICG injection and use infrared, you need these telescopes. They're going to be labeled correctly, I hope, in MDR, and they have a special filter in them. So if you don't have these, you won't be able to see the infrared. Okay? And you have 6 of these. You have 2 5 millimeter 0 degree, you have 2 5 millimeter 30 degree, and you have 2 10 millimeter 30 degree available for the infrared scopes. Okay? You also have some new arthroscopy sets. So it has 4 pieces. You have your trocar, your 4 millimeter telescope, which comes in both 30 degree or 70 degree. You have your sheath and your dual action stopcock. Okay? So putting this together in the sheath, and then to remove it, you just hit the button, okay? We're gonna put the stopcock on now. This is a bit trickier. So it's all attached, so you'll remove telescope, and then this little tab is a pull tab. So you're gonna pull it up. It's a tiny pull, okay? So you can see that again, up and then pull, okay? So that's just something to note when you're taking the sets apart and putting them together. All right, so next steps would be the tower itself. You have your insufflator, which you already have these on every tower, so that's the same exact setup. You have your processor and light source. It's an LED light source, so you won't get that heat like you do from the xenon bulbs. And then you have your processor, all touch screen, very similar to your endoscopy tower. You have the drop-down menu based on what service you're working with, so laparoscopic or ortho. So we'll do laparoscopic, select it, and these are your options. So you have the lamp, you have white balance, your brightness, you have your infrared button, and your infrared gain. So you can adjust the gain from low, medium, high. And then of course, patient data, if you need to enter it, you just hit that button and you can put the type of procedure and the patient name.
So do we have to put patient name every case?
I think ortho likes to do that.
Okay.
So that's why I wanted to put it on the main screen to make it easier for you. We can discuss with general and gynae if they want. And then you have your digital zoom here. So if you want to increase the size of the image on the screen, you can. And then you have your end exam. So end exam is important to press after each case because every patient's pictures and timestamp patient ID and name will be in their own folder. So keep each patient separate.
Okay.
So that's always a good scope of practice because if the printer doesn't work, then you know you can just pick the patient's name and force the print after. Okay? In terms of setup, we'll show you here, telescope on, Olympus light cord is a screw on as well here. And then we'll turn the lamp on, and then you can see the image here on the screen. So what I'm going to do is I'm going to hit that continuous autofocus, and you can see that it's going to manually keep the focus for the whole case and keep that brightness as they move the scope around. Okay? That's kind of everything in a nutshell for the laparoscopic side. In the case when they inject the ICG drug, they're going to ask you to come over and hit the IR button. So it's going to be intermittently during the case. So you can see up on the screen it says IR and white light. right in the top right corner, okay? And then you can see it's green now. So that's what it'll look like when it's excited by the ICG drug, okay? And then you'll just have to tap it off.
Okay.
Because it's just a quick look. They're going to be using this for large bowel cases, so for lap cholecystectomies, anything for ureter identification, as well as perfusion at the anastomosis. So it'll probably be changed on the pick list going forward, as well as the IR telescopes. I think that's it.
So if we don't put patient name in here, so if we want to take a photo, can we take a picture?
You can still take photos.
Oh,
Yeah, it's just if they want the name printed off on the picture and they want the name to identify what pictures are in here.
Oh.
They're all time and date stamped,
Okay.
but it's more just, it's up to the preference of the surgeon. But I think ortho does that.
Yeah.
So-
one question: do we have to do white balance every time?
Yes, but the doctors can do it from the field, so you don't
Okay.
have to do it. So lamp on and off, white balance, and take pictures. So I think they're going to be doing that.
Okay.
But if you have to do it, it's right here on the screen,
Yes.
just in case for whatever reason they don't
Okay.
do it. But
So-
yeah, it'll be nice not to have drapes anymore.
Okay. If the photo is not working on the handle, so can we capture from the machine?
Yeah,
here?
yeah, same as
Okay.
you always can. Just capture,
Capture.
print.
Okay.
Yeah, but it should work from there
Okay.
because it's set up and we've tested it all. So
Okay.
hopefully you don't have to do that.
Okay. Thank you so much,
No
Stephanie.
problem.